About my health policy practicum report that was intended to be achieved for the master's degree. It's talking about the development of CADD policy for use in pediatric palliative care services. Here is my outline. So the purpose of my health policy practicum actually was to develop a draft of the computerized ambulatory drug delivery, which is the CADD policy, for the pediatric palliative care service at the IWK Health Center in Canada. So the policy draft should ensure two main points, which are the safety of pediatric patients and their families, as well as the professional practice consistency and effectiveness. And here my project objectives that was which were carrying out a thorough review of up-to-date literature associated with infusion pump devices and identifying any existing CADD pump information at the IWK Health Center as well as in other health sectors in Canada, and also exploring the use of pump in various departments at the IWK Health Center, reviewing existing policies related to the use of the CADD pump, complete the health policy practicum fieldwork required to achieve a master's degree, and finally preparing a draft completed for the form of the CADD pump policy for the pediatric palliative care service. So, as a literature, as was found in the literature, that the number of children requiring a palliative care approach has been increased significantly. So in Canada, 50 out of 50,000 children has been requiring palliative care services, and actually annually 5 of those children they are dying. So, and according to the WHO in 2011, it says that it's estimated yearly 63 of children, pediatric patients under 15 years old are requiring palliative care at the end of their life. So that's why the provision of pediatric palliative care service is critical for improving the quality of life for both the children and their families. So one of my work is, while achieving the master's degree, is reviewing the infusion pumps that were used worldwide, which were like enteral pump, patient-controlled anesthesia, as well as insulin pump and inhalers and ambulatory drug delivery. So, but there was actually a lack of research and evidence-based practice about the computerized ambulatory drug delivery. So CADD pump actually is a delivery system for providing medication to patients at either home, hospice, or clinical settings. And medication can be given via the CADD pump at a continuous rate of infusion, could be breakthrough dose or demand dose. So in order to develop a policy, so we have to know first the meaning of policy as well as using a conceptual model that can be followed to achieve the policy development. So in general, policy is defined as a statement of a standing decision or a principle that is undertaken by an organization for determining a given problem or issue or situation. So, many conceptual models has been reviewed, and actually the stage sequential model, which called policy cycle moving from issue to policy model, was followed to develop the policy. So one of the reasons for using this type of the policy model is actually correlation with the nursing process, which is the assessment, planning, intervention, and evaluation. So the model starts with setting the policy agenda, which is identifying first the problem and recognizing the issue, and then the policy formulation, which would, by moving into action and legalization, and finally the final two steps are policy implementation and policy evaluation. But actually here in the while developing the policy, only setting the policy agenda and moving into action and legalization were used, but the strategies for how to implement the policy and how to evaluate it is going to be just discussed. So a number of policies were reviewed from the 5 health centers. As you can see, the Capital District Health Authority, Gasborough and Dublin District Health Authority, Northern Health Authority, and South Shore District Health Authority, and St. Thomas Ilan General Hospital. All these 5 health centers have shared mailing in terms of the policy, have shared most of them the same principles. However, some of them they were applied to adult in general, adult population, and some of them just for the hospice settings. None of them they were in the children for pediatric population. However, actually while reviewing the policies, it was found it's applicable even for the pediatric population. So the method that we used, starting with the policy agenda setting. So the problem was identified. So in terms of the problem, it was found that lacking of a pre-existing policy for using the CADD bump in pediatric palliative care healthcare services at IWK Health Center, raising the issue of having to have a policy. And also it was found that there is a widespread of CADD bump use with a diverse pediatric population at the IWK Health Centers. So that's why these are the problem identification as well as the higher risk to the patient safety. Raise the problem for there should be a policy developed. So the second method is the stakeholder identification. So stakeholders were identified, they were interviewed by unstructured and semi-structured interviews. To gain their feedback about the CADD bump use and how to develop the policy. So the second stage, which is the policy formulation. So information compilation from the literature review, as I already mentioned before, and also by reviewing the records and available data, and that was done through using the Dalhousie University Health Policy Management System link, which is OP3, one province, one process, and one management website. And also there was the clinical nurse specialist of the palliative health care services at the IWK Center has contacted with Canadian Policy and Procedure Network over the Canadian health centers. So in terms of the unstructured and semi-structured interviews, work done with the stakeholders, as I mentioned, with the stakeholders, also with the pediatric medical unit registered nurse who had an experience for about 1 year of using CADD bump, and also with a parent of an 8-month-old child who has been using 2 CADD bump for infusing total parenteral nutrition. So the main findings of the interviews were about the benefits of the CADD bump and also the challenges inherent in the practice of the CADD bump. The benefits were mainly about that it was found the CADD bump use can ease the ambulation of the patient, so the patient can go out of the hospital for days, or could be just to take the CADD bump with him or with her at home. And also the use of the CADD bump was actually at the beginning was struggling, but then it just took for the stakeholders to about 15 minutes to be capable to know the process of how to use the CADD bump. In terms of the challenges, as I mentioned, the equipment in terms of the technology was at the beginning just difficult, about 50 minutes, and then was easy. And also the parent of the child says it was difficult to have a child with 2 CADD bump and carrying out the child. However, if there is a support, like for example his wife, it was easy to carry out. So here the policy draft after it was developed. So the CADD bump policy was developed, as I mentioned, reflecting the IWK Health Center's mission, vision, and core values. It's applied to mainly pediatric palliative care service, pediatric hematology, College and College Service, pediatric medical unit. And this policy refers to a specific model used by the pediatric public care service at the UK. In terms of the policy statement, it stated that caring of a patient receiving an infusion of total parenteral nutrition via the CADD pump will be carried out by registered nurses, physicians, and pharmacists. And healthcare providers should have completed education and training on the specific model of the CADD pump in an annual basis or as needed. In the guided principles and values, it was stated two main points, which are the indications and the benefits. So the indications for use of the CADD pump that can be used through intravenous or subcutaneous and epidural infusion, and the benefits mainly about having a continuous rate of infusion and also easing of the patient's accumulation. In the procedure and protocol point, it was discussing the professional roles and responsibilities for each healthcare provider, and that was written in order to prevent the confusion and overlapping roles of healthcare providers. And the second point, the procedure protocol is talking about the patient and caregiver education, who should give the education for the parent, and the availability of 24 hours per 7 days of the emergency of the hotline and the emergency line for in case there is any emergency situations happen. And finally, the documentation, what should be documented, and the checklist that should be used while using the CADD pump, and the checklist that should be used while delivering the education for the parent, and to make sure they have the discuss that are required. So, in the second two stages, as I mentioned, it wasn't actually carried out by the here in the policy development. However, the strategies for disseminating the policy were mentioned. So it's mentioned that policy can be implemented through in-unit education, a self-learning package, and online CADD pump learning module. And policy can be evaluated whether the proposed policy has achieved its intended goals, monitor the approaches of policy dissemination, and measure health outcomes and quality improvement. So the question, when do we need a policy? So if the policy, we need a policy if we are looking for consistency and transparency, if there is, if we are thinking about the quality improvement as well as the accountability and patient safety, and also if the like for example the CADD pump has been used for 10 years in that care center, so that's means it's institution-wide spread use. So that's why we need to develop a policy. So in terms of the implication of policies, one of the considerations that has been raised is the certification. So it's actually the certification there were by the pediatric care services. They were thinking about the certification that some of the nurses should be certified to use the CADD pump, and these are some of the pros which are having the certification can enhance the professional credibility and autonomy, augment nurses' empowerment and clinical excellence, validate healthcare workers' specialty knowledge and clinical competence, and improve patients' outcomes. However, there are some of the cons. Being certified can be lifelong or periodical recertification. It's can require expensive certification tests as well as time consuming. So there are some of the tips for developing and drafting a policy. So the policy should consider consultation, should be consistent, should be practical and effective, fosters critical thinking, should be straightforward, clear language, reviewed and updated regularly, user-friendly and informative, and not fully descriptive. So in conclusion, the focus of this health policy project was the development of a policy draft for CADD pump use, and the main goal of the policy development was the safety of patients and their families, as well as the effectiveness of professional practice. And the development of the proposed policy was guided by the use, as I mentioned, the state situational model, which is moving from issue to action. And they recommend the methods of the policy development, which were including the problem identification, issue recognition, stakeholder identification, and information compilation were explained. The recommended approaches for policy implementation and evaluation were described, and finally, policy implication were discussed. Thank you.